Achieving patient satisfaction through patient-centered care. In an ideal world, patients would come to this nurse's clinic before their appointed time, check in, and complete necessary paperwork, and then be in the exam room with their provider by exactly their appointment time. The provider would listen to the reason the patient made the appointment as well as subjective assessment data, all before opening a computer or getting out their stethoscope. The provider would then complete their own assessment and discuss their findings in a language easy for the patient to understand, and present the patient with possible solutions or treatments. The patient would have the opportunity to ask questions, weigh the pros and cons with the provider, and discuss how the options fit in with their life and any individual needs or concerns they may have. The patient could then make an informed decision, either on the spot or later, after discussing it with their family if needed. This scenario describes an ideal patient experience. If every patient were able to have this experience, the clinic's patient satisfaction would skyrocket, as would the rate of positive outcomes. Unfortunately, in this nurse's clinic, there is often not time for this ideal scenario. Patients and providers run late, and there is not time for this type of thorough, individualized care. The providers do their best to provide the standard of care treatment for each problem. However, most patient problems are not one size fits all. One way to work toward this ideal situation is to focus on patient-centered care. In 2001, the Institute of Medicine introduced a report called the Crossing the Quality Chasm: Healthcare in the 21st Century. This report contains 6 dimensions of care to be improved upon. One of the 6 dimensions focuses on care that is patient-centered. The IOM endorsed 6 dimensions of patient care, which stated that care must be respectful to patients' values, preferences, and expressed needs, coordinated and integrated, provide information, communication, and education, ensure physical comfort, provide emotional support, relieving fear and anxiety, and involve family and friends. Patient satisfaction. The problem we will tackle is the lack of individualized care due to long wait times and short provider interactions that result in low patient satisfaction. This is important because patients' experiences with communication with providers correlate with adherence to medical advice and treatment plans. Patients with better care experiences often have better health outcomes. The improvement plan for this problem will be to improve check-in and scheduling processes to allow more time for individualized care. The mission statement describes the reason for the process improvement plan. The mission statement behind this process improvement plan is patients deserve quality, individualized plans of care that involve their families and support systems. This benefits key stakeholders because the patient can then make informed decisions that result in meaningful, sustainable, positive outcomes. They get their money's worth. The provider's practice is enriched with purpose and positive patient relationships. It's more than just a job. And the organization receives reimbursement and maintains quality certifications. The vision statement for this project is that patients will receive respectful, individualized care at every visit to the clinic. They will leave feeling empowered and supported. Patients and their families will have the information and resources necessary to achieve and maintain their own best state of wellness. A SWOT analysis examines the strengths and weaknesses within the organization and the external opportunities for and threats against the goals of the organization. For this project, the SWOT analysis shows the strengths include that clinic staff are committed to providing a positive patient experience and that the organization is in a position financially to invest in process improvement. Weaknesses include that current processes are slow and take away from the patient experience. There is also a lack of time and high caseloads, which are barriers to providing thorough, individualized care. Opportunities include the recent advances in technology that can streamline check-in, scheduling, and rooming processes. Threats are that patients may still arrive late due to personal or unforeseeable delays. Some patients may be indifferent to their plans of care, or will not buy in, and technology can still malfunction or patients might have trouble using it. The aim statement for this project is the clinic will implement self-scheduling and check-in software to streamline scheduling, check-in, and patient screening processes. This will save time and provide more accurate information to the clinic and providers. This will ultimately improve outcomes and increase patient satisfaction. Patients, providers, and the organizations will all benefit from the project. The time frame is that the new software will be completely implemented within 6 months, and the nurse will know the project is a success when the clinic receives at least 80% satisfaction rating on patient surveys. The leader ensures that stakeholders are engaged by undertaking the processes directed toward addressing problems and issues, and that they have the essential tools necessary to do so. They are responsible for seeing that the needs and resources converge in a meaningful way, and that through the application of these resources, issues are addressed, problems are solved, and change is advanced. This means that the leader will provide the necessary education, time, and structure for the team to work out and implement the process. In conclusion, this nurses clinic can improve patient satisfaction by providing a better patient experience through more individualized patient care. In order to achieve this goal, the nurse leader will facilitate the implementation of new check-in and scheduling software that will streamline the process so that the provider has more time to develop with the patient a plan of care that will improve patient outcomes. This should result in increased patient satisfaction, which benefits the patient, provider, and the organization. Thank you.